Today, we're diving into the fascinating world of therapeutic fasting, a practice that has been around for centuries. We'll explore its basics, its potential health benefits, and what you can expect when incorporating it into your lifestyle. Therapeutic fasting shares some similarities with intermittent fasting, particularly in how it impacts weight and overall health. However, the effects of therapeutic fasting, especially on weight loss and blood lipid profiles, are often more pronounced and achieved more quickly. For centuries, humanity has adapted to fluctuating food availability. Seasonal changes or natural disasters often led to food shortages, prompting people to develop strategies like seasonal fasting to cope with these challenges. Interestingly, fasting has also been a cornerstone of spiritual and physical healing across cultures and religions worldwide. From ancient texts to modern practices, fasting has been recognized as a powerful tool for both the body and the mind. In Europe, one of the pioneers of therapeutic fasting was Dr. Otto Buchinger, a German physician who systematically observed and documented its effects on various illnesses. His work laid the foundation for what we now know as therapeutic fasting. But the concept of fasting as a health practice is far older. It's one of the oldest known therapies, with references found in ancient Greek literature, the Quran, and the Bible. In fact, the Bible mentions fasting on 74 different occasions. For example, Moses fasted for 40 days and nights before receiving the 10 Commandments, and Jesus fasted for 40 days in the wilderness. Even Hippocrates, the father of medicine, routinely recommended fasting as a treatment. Similarly, the Greek philosopher Pythagoras required his students to fast for 40 days before they could study under him. And closer to modern times, Benjamin Franklin famously said, "The best of all medicines is rest and fasting." It's clear that fasting has been valued for its benefits for thousands of years. While modern research on therapeutic fasting began in the late 19th century, studies remain somewhat limited. Let's start by defining therapeutic fasting. This practice involves the body's ability to meet its nutritional needs, both macro and micronutrients, during a controlled period of food scarcity or absence. It does so by relying almost exclusively on the body's energy reserves, all without compromising your health. Here's an important distinction. Therapeutic fasting is different from intermittent fasting. During therapeutic fasting, calorie intake is drastically reduced, and the focus is on consuming foods or liquids rich in vitamins and minerals. In contrast, intermittent fasting, most commonly practiced as the 16-to-8 method, maintains a normal calorie intake but restricts eating to a specific time window, known as the eating window. During therapeutic fasting, food intake, such as fruit or vegetable juices, is typically limited to 500 calories or less per day. This calorie restriction triggers specific metabolic processes that are highly beneficial for your health. Interestingly, when done correctly, therapeutic fasting often doesn't result in feelings of hunger. There are several types of therapeutic fasting, ranging from the most demanding to more flexible approaches. Complete fasting, also known as water-only fasting, is the most rigorous form, where only water is consumed. Partial fasting includes variations like water and bread fasting, or fasting with the inclusion of fruit and vegetable juices. The duration of fasting can vary widely, from 1 day to 3 or 7 days, and even up to 6 weeks, depending on the individual and the goals of the fast. What unites all forms of therapeutic fasting is the concept of external undernourishment, which activates the body's natural reserves. These reserves primarily include glycogen, stored in the liver, and fat. When calorie intake is restricted, the body undergoes a series of metabolic changes. Initially, it burns through its glycogen stores, which are primarily stored in the liver. A 24-hour fast typically results in a 20% or greater drop in blood glucose levels, depending on physical activity levels. As fasting continues, the body transitions into a metabolic state where it begins to rely on alternative energy sources. Once glycogen is depleted, the liver starts producing ketone bodies from fatty acids. While most tissues can use fatty acids for energy, the brain, normally dependent on glucose, begins to rely heavily on ketones during prolonged fasting. The body's ability to sustain fasting depends on factors like body mass and composition. For most people, A combination of ketone bodies, free fatty acids, and gluconeogenesis allows survival for 30 days or more without any food. The question remains, what benefits can therapeutic fasting bring? As it turns out, there are quite a few. Research, particularly on animals, has shown a strong and consistent impact of fasting on various health markers. These include lowering insulin and blood glucose levels, improving insulin sensitivity, reducing blood pressure, decreasing body fat, and alleviating inflammation. Similar results have been observed in clinical studies. For example, a study published in 2007 examined the effects of cyclical 24-hour fasts and found that a calorie deficit ranging from 15% to 40% improved glucose tolerance and increased insulin sensitivity. Another study from 2017 focused on a patient with type 2 diabetes who underwent repeated fasting periods of 24 and 42 hours over 4 months. The results were remarkable. The patient lost nearly 18% of their body weight, significantly improved their hemoglobin levels, and, after a decade of insulin therapy, was able to discontinue insulin entirely, managing their condition with just oral medication, metformin. Therapeutic fasting has also shown a profound impact on blood pressure. Water-only fasting, for instance, has been found to significantly lower systolic blood pressure. On average, 13 days of fasting resulted in systolic blood pressure dropping below 120 millimeters of mercury, with an average reduction of 20 millimeters of mercury. This effect was observed in 82% of patients with borderline hypertension. Interestingly, even after resuming a normal diet, blood pressure remained lower than baseline for at least 6 days. A small pilot study also demonstrated that 10 days of fasting resulted in a reduction of systolic blood pressure from 37 to 60 millimeters of mercury. While these results are promising, more research is needed to draw definitive conclusions about the long-term effects of fasting on hypertension. Periodic fasting has also been shown to help manage metabolic syndrome by increasing insulin sensitivity, stimulating fat breakdown, lipolysis, and lowering blood pressure. Studies on alternate-day fasting have demonstrated significant weight loss in individuals with metabolic syndrome. Both men and women experienced reductions in abdominal fat, which is particularly important for improving metabolic health. Longer fasting periods, ranging from 4 to 21 days, have also been studied in a program involving over 1,400 participants. The participants were divided into groups based on fasting duration 5, 10, 15, and 20 days. They followed the Buchinger fasting protocol, which allowed up to 250 calories per day and encouraged maintaining a moderate activity level. Daily records were kept of clinical parameters, adverse effects, and, most importantly, participants' well-being. Significant reductions in body weight, waist circumference, and blood pressure were observed across all groups. Additionally, fasting had a beneficial modulatory effect on blood lipid levels, glucose regulation, and other general health markers. In all groups, fasting led to reduced blood glucose levels within the lower normal range and increased ketone body levels, indicating a metabolic shift toward fat utilization. Therapeutic fasting has even shown benefits for individuals with rheumatoid arthritis. Longer fasting periods, lasting from 1 to 3 weeks, have been found to reduce inflammation and pain in patients with RA. While these benefits tend to diminish after resuming a regular diet, transitioning to a vegetarian diet has been shown to help maintain the positive effects. This approach has been supported by several studies, including randomized trials. The benefits of fasting largely depend on its duration. While it's difficult to determine the best type of fasting, general guidelines suggest that fasting periods of 20 to 24 hours are suitable for individuals with low physical activity, while those who are more physically active may benefit from fasting for 16 to 20 hours. Cyclical therapeutic fasting, repeated once a week, appears to be the safest and most sustainable approach for most people. It's important to emphasize that longer fasting periods should always be supervised by a healthcare professional. Improperly conducted fasting can lead to serious health risks. Additionally, therapeutic fasting is not recommended for children, pregnant or breastfeeding women, or individuals with eating disorders. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit from learning about therapeutic fasting. And as always, I'll see you in the next episode. Take care.